Hello everyone, my name is Sandhya Shenoy and I am here today at Motherhood with my gynecologist Dr. Madhushri Vijay Kumar, who has also delivered my two beautiful babies.
Dr. Madhushri Vijay Kumar is a consultant obstetrician and gynecologist at Motherhood Hospital and has nearly 20 years of experience. She has delivered over 8,000 babies. Her interest lies in high-risk pregnancy, reproductive endocrinology and fertility care with special interest in natural birth and promoting normal vaginal deliveries. She has extensive experience in working in India, Australia and United Kingdom and is involved in teaching and training postgraduate doctors for appearing for the MRCOG examinations. She has several publications to her credit as well.
So we are here to talk about sustainable menstruation, menstruation in general, plastic-free menstruation, and we are going to have this as a series. Let's go on to have this communication with Dr. Madhushri.
Thank you, Sandhya, for the introduction. I'm Dr. Madhushri Vijay Kumar, consultant obstetrician and gynecologist at Motherhood Hospitals, Hebbal.
So when I delivered a baby, I was going through the life cycle of a baby, and I found it amusing that the eggs are already in placed by God within the child, and if it is a boy it moves into something else. If
Correct.
It's a girl, she will have those eggs, and that's what will start coming out during puberty. And just to take out the myth of impure blood, what exactly is period blood?
Okay, good question. So the period blood is basically whenever the signal comes from the brain, as I told you, the HPO axis, the ovary gets a signal between day 11 and day 15 to release an egg, which potentially has to meet a sperm and then get pregnant. But in those where the pregnancy is not happening, the shedding of that egg which happens along with the lining of the womb is what we call as menstruation.
Okay.
The menstruation is not impure blood. It is basically something which is natural, like how we get the secretions from our nose, secretions from our ear and eyes. The secretion is from there, but it is a cyclical phenomenon, basically happening because there is an egg release, there is no pregnancy, and then you have a menstruation. So which is something which is physiological. This is absolutely normal shedding of the lining associated with blood. It is not at all impure because it is not contaminated.
So it is a part and parcel of your body, and that's something you have to live with and feel proud about, actually.
Yes.
And what is the problem of PCOD, PCOS? If you can throw a little light on those problems which most women or when the girl attains 18, she is eligible for marriage.
Yes.
And that's one thing that you immediately want to conceive, or you have fertility issues, or you're not able to conceive because of weight. It may be issues with your hormonal or cycles that you said, which takes time to settle. So if we attain puberty at the age of 11 and you have 7 years for it to settle, and if you're probably married off by 2021, these issues usually start coming around, and that's something that if you could throw light on that.
Yes. So PCOD is basically a hormone imbalance. As I told you, the HPO axis, which is important for the normal menstruation, gets a little altered. So what happens is there is not enough feedback from the ovary back to your brain to actually give a signal to bleed properly. So PCOD or PCOS, when we say syndrome, PCOS is basically polycystic ovarian syndrome, where it does have components of ultrasound diagnosis of your ovary looking like a polycystic in nature. You have your blood test showing abnormalities associated with PCOS, and the other clinical features, like the girl may have multiple pimples, she may have increased hair around her lip, around the chin, around the abdomen or the thighs and the legs. So there are different grades of increased hair, what we call as hirsutism. So and then the entire syndromic complex, or if she has all the three features, she has a syndrome.
Okay.
PCOD is what we say, PCO picture is what we say when a girl is coming for something else, with say for example irregular periods and things, and I do a scan and I find that the ovaries are a bit of a polycystic in nature. That means she has got many follicles which are arranged on the outside, and the ovaries look a little bulky. You say it is PCO in nature. But every third girl whom I've seen has got PCO. So it's nothing major to worry about. Fertility can be a little delayed because we don't know when she's going to ovulate. That's the only thing. So if you are able to manage your body weight at an appropriate level, that means not allowing the child to put on too much of weight, what is for obesity, or she's not having a low BMI, that means what we call as lean PCO, majority of the time we do not have any major fertility issue.
Okay.
So-
So how important is diet, lifestyle, and exercise for a teenager or post that, for the young generation who's probably starts going to work? How important are these changes for management of menstruation?
The lifestyle intervention at every level, starting from a 2-year-old child to a 65-year-old women, I would probably say very relevant. Okay. Because what determines your obesity at your adult level is at your childhood level. So if you allow the child to grow normally, not allowing the child to become obese will itself prevent your adult obesity. Okay. So inculcating good habits, normal balanced diet. I do not want my baby to become chubby. Yeah, if it has a adequate weight, that is more than sufficient. As long as the child is active, is able to manage and does not have anemia, I don't think I should be worried at all in that way. Second one, any sport the child takes, the physical sport, I think you should encourage as a parent to continue that at different levels. If they are not able to move it to the professional level, it is okay. But playing a bit of a sport, even at say 25 to 30 years of age, and beyond 40-45, because I am 40 plus, I do make sure that I am physically active at least an hour in a day. So if that continues till you are 65 and at different levels, I wouldn't say don't make it an adventure sport or a difficult sport which will probably physically you may not be fit enough to do, but some sort of physical activity and maintaining your lifestyle with your balanced diet and keep your stress levels low, that is more important, will actually help your reproductive function to fare better.
Okay.
Rather than having any sort of disturbance throughout your reproduction.